Hello, and welcome to day two of the Digital Health Society's fifth summit on behalf of Karolina Mackiewicz and myself. And we are joined today by over 1,225 people from over 90 countries, a truly global audience. Who would have thought 5 years ago, after our first summit in Helsinki under the Finnish presidency's patronage, where we had 100 people, that after a pandemic, we would have to go to a virtual format, and that a couple of years later, we would attract this number of people. It's been a very busy year for us. We've organized a 2-day health event at the UN Science Summit in New York, and we've been invited to be on the advisory board for the Science Summit in 2024. So please watch this space for announcements as we progress the work planning for that. In 2024, it will be called the Summit of the Future, and we'll be looking at important work to see what comes after the current SDGs. Also, we launched the Global Health Connected Village at Health in Las Vegas, and this has become the home for non-US businesses attending the health event in the United States. We had a large exhibition space and a mini stage, and in 2024 that will be increased in size. So again, watch out on our social media for things that we are doing in relation to health next year. We're also delighted to see the number of people attending from Africa, where we have been doing a lot of work in the last couple of years. And we're delighted to be a founding partner of the African Digital Health Network, and more about that later. This year's theme is Connecting the Dots for Sustainable Healthcare, powered by health data and digital. The purpose of the summit is about thought leadership, knowledge and information sharing, and of course it's free to attend. We convene, connect, amplify and accelerate innovation, best practices, and our members. We have been showcasing yesterday, and we will be today, healthcare professionals, hospitals, researchers, NGOs, industry, health systems, and policymakers. The global connected health work we do is focused on 4 things: healthy aging, women's health, green health, digital and data. And the Digital Health Society naturally focuses on the data and digital requirements. So a few shout outs. Big thank you to our sponsors, IQVIA and SNPC, and our knowledge partner, McKinsey's. Today, McKinsey's will be hosting their quarterly Health Tech Network event, and I won't steal their thunder by telling you too much more. But we are delighted that this is another year where we actually host the quarterly meeting of the Health Tech Network. There are many virtual booths that you can visit during the breaks, so please do, as you'll be able to see various EU projects that we are involved in, as well as information about Health Europe, which launches in Amsterdam in June next year, as well as some of our members and our sponsors. Some quick highlights about what I think is going to be coming today. So we have an interesting panel on the futures of health data, reimbursement solutions for digital health, international research and development and FAIR, and AI use cases, as well as concluding with environment, health, and data. I think looking back at yesterday, 5 takeaways for me. 1, the pace of change of health data sharing and use, the analogy of a speedboat versus the European health data space oil tanker are both possible and needed. 2, MedTech Europe highlighted 97% of health data in EHRs remain unused. 3, one patient's health data is another patient's medicine. 4, EU member states must rise above self-interest to allow European health data collaboration to deliver EU competitiveness in pharma and research. And then finally, 5, European citizens need to flip the privacy argument on its head and say, I demand my health data is used. So please remember that the ECHAlliance is a membership organization. And if you think we can help you or you can help us, please contact us. So with that, I'm going to hand over to Karolina and wish you all a good day. Thank you.
Thank you, Bleddyn, and good morning, good afternoon, good evening also from me. It's a pleasure to be with you here today on the second day of the 5th Digital Health Society Summit. And Bleddyn already told us a bit about the summit and what happened yesterday, what is happening today. But for those of you who are joining us for the first time or haven't been connected with us with the ECHAlliance, the Global Health Connector, and the Digital Health Society, I would like to give you a short overview of the organization that stands behind this summit, the Digital Health Society. The Digital Health Society was born in 2017 during the Estonian EU presidency as a mechanism, as a tool to promote the health data and the digital innovations of Estonia. And this is the multi-stakeholder movement. This is the multi-stakeholder community where currently more than 200 organizations are engaged, and those organizations represent the different domains of the digital health ecosystems, from patient organizations to healthcare providers to academia to companies, EU organizations. And it's our great pleasure to let you know, and we're very happy to announce that this 5th Digital Health Society Summit is gathering over 1,200 participants. So we are very grateful that so many of you decided to spend those 2 days with us, and also those numbers have grown since yesterday. So we are very, very happy to see the audience growing. And we are also very happy to see that the audience is coming from different parts of the world, also outside of Europe. We have people in the audience that are academicians, like scientists, and that are leading the companies, are coming also from the government and from civil society. So we are truly a multi-stakeholder gathering. Just a couple of words what the Digital Health Society does. So Digital Health Society is the data arm of the ECHAlliance. This already explains a lot. This explains that this is also, as Bleddyn has mentioned, this is the part of the ECHAlliance, part of our organization that specifically works on the digital and health data through, for example, our roundtable program that I will say a little bit more in a couple of slides. Of course, we organized the annual Digital Health Virtual Summit, 5th time this year. The Digital Health Society also supports the digital and health data activities of the whole ECHAlliance Global Health Connector and provides the expertise to the EU-funded and development projects. Also, another key activity of the organization is the AI Club that I will say a little bit more as well. And the Digital Health Society is planning the hospital clubs, and those clubs are for benchmarking, collaboration for innovation, but also research and commercial activities. I already mentioned the roundtable program. This roundtable program was organized together with the European Institute for Innovation through health data. It ran from 2020-22, and it was sponsored by Johnson & Johnson, Microsoft. And as a result of this roundtable, a number of different reports was produced. And one of them is this call to action on health data ecosystems. You can see on this slide those call to actions, and I would like to just highlight a couple of them. that also guide us through our activities and are the foundation for this Digital Health Society Summit. So, for example, the first call to action: raise the digital literacy and skills of all stakeholders, or generate and value trustworthy evidence, accelerate interoperability across Europe and globally. So if you attended our summit yesterday, you already know that we had a number of sessions on exactly those topics. And here on the slide, you can actually get the QR code. You can scan it for easy access to the whole library of those reports coming from the roundtables. So I promise you a word or two on the AI Club, and this AI Club was launched pretty recently. This is run by invitation only and under the Chatham House rules. And this is also the multi-stakeholder gathering to discuss the pressing issues, possible solutions around the AI and health data. Bleddyn already said that the ECHAlliance is the membership organization, and it also is this is the list that presents this network. And one also of the activities, or our focus has been this year developing the ecosystem network in Africa. And I wanted to highlight this for this particular reason, to actually give a bit of visibility to this activity and the visibility to how big and rich in opportunities, challenges, but also opportunities Africa is. Africa is rising, and we also support the activities, for example, by being one of the members of the African Digital Health Networks. We also are host for the thematic innovation ecosystem. So those are multi-stakeholder virtual gatherings to bring people, organizations together around a certain theme of their interest. You can see here that we have currently 16 running ecosystems, and you can always engage with them. One of our newest ecosystems, thematic innovation ecosystems that are being launched are those two that you see on the slide: healthy aging and women's health. And we invite you to collaborate with us on that. So if you have interest, knowledge, good practice, expertise in those themes related to the healthy aging and women's health, we invite you to get in touch with us. You can always get in touch with me or Bleddyn or any other person in the organization. But our colleague Andy Bleddyn, who is the communities director, is the best person to connect. So again, I would like to invite you to follow us for the second day full of learning, exchange, and action. And thanks to our sponsors, IQVIA and SNPC, and our knowledge partner, McKinsey, for their support, that without them, it would not be possible to have this rich, big, and interesting event. So thank you from my side, and thanks on behalf of Bleddyn. And after a short technical break, we invite you to our first session of today, which is on futures of health data. So we want to set the scene for further discussions of today. Thank you.